I know some hospitals are also on the much smaller side, so a lot of PTs will just go to 1,000 different floors in one day, and that's their routine. So many different ways, just like an outpatient facility. Hi guys, welcome back to my channel. My name is Stephanie. I'm a doctor of physical therapy. In today's video, I'm going to be doing a little chit chat, get ready with me, sharing what a day in the life of an acute care physical therapist is like. So if you want to hear more, keep on watching. So what does a typical day in the life in an acute care setting look like? I'm going to talk about my old hospital versus my new hospital and how they compare through different parts of the day. I think the one misconception about acute care is everyone's like, oh, every hospital is the same. And that's the one thing that I want to preface this with. It's really not. Just like every outpatient clinic is different from the next, even if they're in the same location, on the same block, they're going to be run differently. The caseloads are going to be different. It's going to be a world of a difference. Typically, a day for me starts between 8:30 in the morning and goes for 8 hours or 10 hours. This just, again, is one of those things that varies by hospital. I will say I know there are hospitals that do 12s. I think that's a little bit on the more rare side, but again, you never know what's in your area. Once you show up for shift in the morning, either your caseload will be kind of decided for you, meaning like you won't be able to choose what patients and what unit you're on. But where I currently am, you kind of get assigned to the unit and have to make your own clinical judgment. Obviously, there's priorities from other PTs who may have seen those patients in the past or over the past few days if you were not working. Like what are their needs? Do they need to do stairs? Are they going for surgery? And so forth. So it's up to you to kind of make those decisions. You should be prioritizing evals, discharges, making sure that there's any patients that have other needs, maybe like to follow up on equipment that was ordered for a patient and make sure that they're ready to go to home or rehab or wherever they're going to. Once you kind of get that in check, then you can just go through and do a chart review. So this is one thing that I know is super different depending on not only therapists, but on hospital and how it's run. So I'm the type of person that likes to kind of take an overview of my entire list before I go up for the day. And I'll just really skim through to see who has what kind of needs and then take it from there. Some people will only chart review one or two people, kind of just go see them right away, and then as the day goes on, just progress like that. So it's truly person dependent. What I do now after working for a few years is kind of like a mix of both. So if I have a general idea, for example, I come in on my first shift of the week, I will do more of that overarching chart review and then kind of take it and see how the day goes. If I'm maybe on shift like 2, 3, 4, then I will kind of know my patients by now and follow up maybe whoever I didn't see with the day before, or kind of just like see if any of my coworkers need help on other units because maybe my patients don't have any important needs. What I used to do at my first job was more so of see how many patients I could in the morning and then do notes like closer to lunchtime in bulk. What my new hospital is doing is they like to see a patient and do notes, and patient and do notes, a patient and do notes. It's very hard to break old habits, so I've been trying to conform to that, but I noticed that there are times where I'll just like run from room to room, especially if I've chart reviewed like 2 patients at a time. Once I see them, then I will do a quick check-in with the nurses as well as any physicians that are rounding at that time. The other difference between my old hospital and my new hospital is that my old hospital, our supervisors were the ones that went to rounds, and then they kind of just let whoever the therapist was on the floor know, like, hey, this person is important for this need, whatever. At my new hospital, they actually have us go to the rounds, and they don't take long at all, but it's a great way to not only connect with the case managers, the physicians. It is also just a great way to kind of show our understanding of the patient's needs. And if it's a patient, for example, that maybe we haven't seen that week, but another therapist has seen, then we're able to kind of go through the chart and tell them like, hey, this is what the note says, and this is what it means. It doesn't look like this patient can go home or they can go home and so forth. Because as much as I do want to say that people read our notes and understand them, it's not true. So once we either see a few patients, go to rounds, finish documenting those few patients, it just continues. So the one thing I like about acute care is that there's no schedule. unless you have a scheduled meeting or rounds, but there's no schedule. So I like the freedom of, if I need to sit down for 5 minutes and just take a breather and go back into the chart, check on somebody and follow up, I can do that. And I don't have to worry about missing an appointment or somebody running late. Once I'm kind of settled into the day, I've seen about maybe 4, 5, 6 patients, depending on if it's a good day, a busy day, or everyone's refusing me kind of day. And then I go to rounds, maybe there's a staff meeting or an in-service, then it's lunchtime. Lunchtime is lunchtime. We do not work on lunchtime. I'm gonna emphasize that. We do not work on lunchtime. Then once we come back from lunch, it's the repetition of the morning. But essentially the morning is just obviously seeing more patients. If it's an 8-hour day, I'll see maybe 2 or 3 more. And I'm also tying any loose ends that maybe someone needs to be discharged or there's a last minute eval put in and that person is supposed to go home in an hour and they just put the PT consult in 30 minutes ago. It happens. So the one thing I like about acute care is your day is kind of planned out, but like not at the same time. So like I said, we don't have schedules, but you're kind of assigned to units. And then what's great about the unit, if it's maybe a little bit lighter on PT orders that day or lighter on patients, you can kind of float to other units. However, with that being said, you see a bunch of different patients in one day. So you can see post-surgical patients, you can see medicine patients, you can see emergency ED patients for all you know. So it's completely like your knowledge is, there's nothing that's ever like not once going to use because you can just be pulled in 1,000 different directions. So that's the one thing that I kind of really enjoy out of it, and that's why I like it so much, because you're using so much knowledge, and like if you forget something for one day, you bet you're using that knowledge the next day. I know some hospitals are also on the much smaller side, so a lot of PTs will just go to 1,000 different floors in one day, and that's their routine. Like I said, every hospital is different, and your staffing needs are different, your therapist needs are different. Maybe you don't have an ICU, maybe you have no surgical patients because they don't do surgery at your hospital. There's so many walks of life. So many different ways, just like an outpatient facility. Once you're done with seeing those patients, again, however you do your chart review and your documenting is completely up to you. I like to kind of bulk it, but that routine now has to change a little bit. Once you are done with seeing your patients for the day, you coordinated all care, you tied up all the loose ends, it is officially time for you to go home. It's honestly that simple, and I know it's like everyone thinks that there's always some grand old mystery to acute care because it's hard to get A, experience in the hospital, and B, it's not like outpatient orthopedics where you can film a video on a plinth and put it for the world to see. So when I talk about acute care and just overall in general, yes, do I help people walk and do I help people get up? Yes. But what is the end goal and what are they in the hospital for? So when people always ask, well, what exactly is it do you do in the hospital? It's a plethora of things, and I go wherever the day pulls me, and that's why I love it. Not only, like I said earlier, the variety of patients, but just every day is a little bit different than the one before and then the one following, and it really just keeps you on your toes. You never know when a person's gonna have a sudden change in their vitals or their medical status. Sometimes, for example, strokes don't show on MRIs, and you're the one doing a more thorough neuro exam, and you're like, oh gosh, what is going on with this person in front of me? They have sudden weakness. Not everybody has a facial droop or speech changes. Maybe they just have gait changes, because the strokes can be in different parts of the brain, and they don't always show up on scans. So that's why I love it, because there's so many walks of life, so many ages, so many past medical histories, things that you really need to understand. I hope you enjoyed this video. I know it was a very quick overview, but like I said earlier, there really is not much to it. It's not one big secret to learn what a day in the life is like in acute care. Thanks for watching. Make sure to leave a comment down below if you have any questions, and make sure to subscribe to the channel to get notified every time there is a new video. Thanks for watching.